Well, as the coronavirus continues its rampaging across the world, we're beginning to understand that the interventions so far, the physical distancing, the wearing of masks, the washing of hands, they're absolutely vital, but they cannot bring the pandemic to an end. The only thing that can bring it to an end is treatment on the one hand or a vaccine on the other. Treatment seems terribly elusive at the moment. The concentration is hugely on developing a vaccine. There are over 100 vaccines in development now, and 12 or 13 of them are on the verge of human trials. One is already in human trials. That's the AstraZeneca drug company in combination with Oxford University providing a vaccine which has several thousand enrolled in the United States, 2,000 enrolled in South Africa, 3,000 enrolled in Brazil. They're really doing a job and everybody is on tenterhooks to wonder what's going to happen. And they've already sold hundreds of millions of doses to the European Union and the United States before the vaccine is even approved, indeed fully tested. And they have manufacturing ability, they say, for 2 billion doses, and money is pouring in. But here's the catch, here's the rub. Everything is so disorganized, confusing, set up in silos and compartments. For example, this last weekend, there was a fundraiser for COVID-19. They raised between $7 and $8 billion. It's not a lot in the scheme of things, but it's a significant amount. So some of it went to global public health, some of it went to economic renewal. But in terms of recipients, a chunk went to the World Health Organization, to UNICEF, to the World Food Program, to the Global Fund, to the Global Vaccine Initiative, and to something called ACT Accelerator, a group of countries coming together to try to rationalize all of this. But the fact of the matter is that it's too disorganized. The NGOs, civil society, have been pressing these various agencies and groups to let civil society have access. But it looks as though it's not going to happen until the end of August or September. Think of what is occurring in the interim. So what it needs is some person or group or entity to organize it all, to give it focus. And since the World Health Organization seems unable to do that, it should come to the United Nations Central. It should be the office of the Secretary General using his authority and influence to make sense of the whole elaborate construct. You see, those of us in the rich countries have very little to worry about. When they discover a treatment or a vaccine, you can be sure we'll have access. But what about the rest of the world? What about the uprooted, disinherited, marginalized, and impoverished? Are we seeing it all again, as I've said on other commentaries? The UN has a saying that they've used ad nauseum, leave no one behind. Well, as things now stand, without central organization of what is happening in the face of the pandemic, there will be tens of millions left behind. That was last week. I'm Stephen Lewis.